Dear students, today's presentation will see what is the reason for combining lidocaine, what's another name of lidocaine, lignocaine or xylocaine, along with adrenaline, what's another name of adrenaline, epinephrine. So why it is always given in combination? Okay, this is the repeatedly asking questions, repeatedly asked question. So we'll see what is the advantage. So if you are giving and the dose for the combination, it is given in the previous video. Lidocaine 1 is to 1 lakh, 1 is to 50,000 and 1 is to 2 lakh ratio. So it is given in combination. What is the advantage? The first one, it prolongs the contact time, the drug contact time with the nerve fibers. Okay, so it is increasing the drug contact time, or we can say the affinity. Okay, so it is increasing the affinity or the drug contact time, it is increasing. And second one, it decreases the rate of removal. Okay, so it increases the contact time and decreases the rate of removal. In that way, it is prolonging the duration of action. Okay, so the drug, if it is going to bind with the particular receptor, for example, we can say it is having the higher affinity. So the drug is, it increases the contact and decrease the removal time. So prolongation of action. So first advantage, in simple words we can say prolonging the duration of action. Second one is systemic toxicity. It is reduced when you are giving in combination because adrenaline is a powerful vasoconstrictor. So it reduces the absorption rate and also the metabolism. So systemic toxicity is reduced. That is the second advantage in combination of lignocaine and epinephrine. Third one, prevents blood loss in minor surgery. That is the important or the main advantages of the drug which is given in combination along with adrenaline, preventing the drug loss in case of the minor surgery. So these are the main reason. Then next, coming to the disadvantage. So what is the first disadvantage? Local tissue edema. So tissue edema, edema means swelling. The second disadvantage, necrosis, cell death. The third one, hypertension. The fourth one is arrhythmia. So this is the disadvantages of the drug which is given in combination with epinephrine. Next we will move on to pharmacological actions of lignocaine. So this is the general or common pharmacological action of the local anesthetics. So first one, in the central nervous system, what are the effects it is producing in the central nervous system? So common pharmacological action of local anesthetics, generally it will produce excitement. Okay, then restlessness. So CNS stimulation is occurring. So excitation, restlessness, followed by seizure and unconscious stage. That is if you are increasing the dose finally, or if it is above the therapeutic dose, it is producing the unconsciousness. If you take the example of drug cocaine, it is a powerful CNS stimulant causing euphoria. Okay, So the euphoric effect of the cocaine, euphoria means the sense of well-being, and is due to the central nervous system stimulant effect. So it is a powerful CNS stimulant which is misused. Okay, cocaine is misused drug when you are giving at higher concentration. In lower concentration, it is having the therapeutic value. And mental confusion, tremors, respiratory depression followed by death. So these are the effects in case of cocaine because it's important drug. Then coming to the cardiovascular system, pharmacological actions of local anesthetics. What are the effects it is produced in the cardiovascular system? Intravenous administration of LA. LA is local anesthetic, results in decrease in automaticity. Automaticity, it denotes the generation of impulse. So in the cardiac muscle, rhythmic automaticity, okay, it has to contract and relax on its own automaticity without any nerve innervation. So it is reducing the automaticity, reducing the or decreasing the excitability. Next, it decreases the contractility. So contraction of atrium and ventricle is responsible for the pumping out of blood directly cardiac output. So it is reducing the force of contraction, contractility. And the next one is it is reducing the effective refractive period. Sorry, it is not reducing, it is prolonging the effective refractive period. So refractive period is nothing but the time interval between the primary and the secondary impulse. So the time gap between the first impulse and second impulse. So because of this characteristic features, prolongation of ERP, effective refractive period, is used as an antiarrhythmic drug. So therapeutic uses, antiarrhythmic drug. The next one is actions, pharmacological action in blood vessels. So blood vessels can divide into two. Say similar, low dose and high dose. Here therapeutic dose and toxic dose. What will happen to the blood vessels? So in blood vessels, due to the action, that is atriolar, in the atrial muscles, so therapeutic dose, it produces fall in blood pressure due to sympathetic blockage. Okay, so hypotension occurs, but at toxic dose, due to the sympathomimetic action, it is increasing or it raises, increasing the blood pressure. Hypertension occurs. So therapeutic dose, fall in BP, but at toxic dose or higher dose, it is not the higher dose, toxic dose, it leads to hypertension. So these are the important pharmacological actions of local anesthetics. Then coming to the uses. So uses we can say, or what are the various techniques by which you can administer local anesthetic. Techniques of local anesthetics, or simple you can say what are the uses of local anesthetics. What are the ways by which you can administer the local anesthetic drug, or what are the forms it is available for the easy or convenient method of administration. So first one is surface anesthesia. or surface anesthetic, you are having so many drugs. Second one, infiltration anesthesia. Anesthesia means the process of the induction of anesthesia. Infiltration anesthetic means a drug which produces the particular technique. Conduction block. The third one is conduction block. Conduction block is nothing but you are blocking the particular nerve or the plexus of nerve or particular field. If you are blocking, then it is called field block. If you are blocking the particular nerve, it is called nerve block. The fourth one is spinal anesthesia. Into the spinal cord, the drug is producing the anesthetic action. Fifth one, epidural. Dura mater, pia mater, arachnoid mater. Epidural space. Okay. So epidural anesthesia. Sixth one, IVRA, intravenous regional anesthesia. This is also the important question for any exams or for a viva question or for 2 marks question, repeatedly asking question. IVRA, intravenous regional anesthesia. Even for 5 marks, you have to elaborate what is the procedure and what is the drug, what is the dosage, and what are the surgery, minor surgery this technique is applied.